a lot of people have these myths about ADHD, that it's a behavior problem, a discipline problem, they're just not motivated enough, or it's because of bad parenting, or medication is the only way to treat it. Or other people think that if you're smart, you cannot have ADHD. Or they'll be like, oh, I don't think you have ADHD because you're not hyper. But all of these are myths. There's different presentations of ADHD like we just discussed. And again, it's not a voluntary issue of wanting to do well or not being motivated. There's actual structural, neurobiological, and neurochemical changes in the brains of people with ADHD, specifically in the prefrontal cortex. So the prefrontal cortex of people with ADHD is severely impaired in multiple ways. And the prefrontal cortex impairment causes dysfunction in executive functions like attention, planning, and self-control. And if you look at brain imaging studies, you see that there's actually a decreased volume of the prefrontal region and decreased activity. SPECT scans show that's even decreased blood flow to the prefrontal region, especially in the right frontal area. And fMRI studies have shown that there's reduced activation in parts of basal ganglia and thalamus as well. This is a picture of an fMRI study. The top is neurotypical brain. So neurotypical brain is, I don't like to use the word normal because there's no such thing as normal. There's neurotypical brains that are more common and more typical, and then there's neurodivergent brains, ADHD being one of them. So on the top is a neurotypical brain and the bottom is an ADHD brain. And you can see there is reduced activation in the thalamus, basal ganglia, and in the right ventral inhibition network. So their inhibitory networks are severely deactivated. So what is on all of this is in the prefrontal cortex. And the prefrontal cortex has 3 core executive functions. One is inhibitory functions. So this is anything that inhibits your impulse, your immediate animal instinct. So say somebody hurt you and you don't immediately blurt out an inappropriate thing. That's when your inhibitory function is coming into action. And inhibitory function also is important to ignore distractions. Because for a neurotypical person, if you are watching someone talk or watching a presentation and someone drops a pen around you, you can still ignore that and pay attention to the person giving the talk. Whereas for a person with ADHD, they just cannot ignore it. Their brain will make them want to look at the pen, see what's going on, see what the other person did, then maybe come back to the presentation for a little bit, then look out the window. They're just unable to inhibit their urge to follow these distractions. And the other core executive function is working memory. Working memory is the ability to hold temporary information in your brain. It is different from short-term memory because you're not just holding information, you actually need to hold this information, extract the right stuff out of it, and manipulate it to figure out the next steps to do. So whenever you have a multi-step task or a list of things, you need working memory because you need to be able to remember the previous task so you can do the next. You can plan your plan that way. And cognitive flexibility is important for problem solving and having a different perspective. So you need to be able to shift your perspective and not follow the same routine you always take, or not do things that you're used to do, things that are easily tempt you. If you want to break that pattern, you need cognitive flexibility. And all these 3 functions, so problems with inhibitory control, what else? As I mentioned, it affects distractibility because you're unable to ignore the distraction. It can also cause anger and mood issues because, again, it's the inhibitory control that stops you from reacting immediately. But take a moment, have your prefrontal cortex kick in to allow you to make rational decisions. And it can also cause discipline problems because if you don't want to do homework and somebody tells you to do homework, or your boss tells you to finish a task and you just don't want to do it, so you won't do it without thinking of the consequences because your inhibitory control is not switching in gear. Problems with working memory. The working memory is important for a lot of things. So like I said, if you tell an ADHD person, if you give them a list of 5 things, you need to get bread, milk, eggs, they will go to the store, spend an hour, and come back with peanut butter and jelly and totally forget the things they're supposed to get. It's because of issues with working memory. It also is very difficult to do any kind of mental math because you need to remember, if you're doing addition, subtraction even, you have to remember the carryover for that brief moment and then use that information to manipulate your answer. And people with ADHD have a lot of trouble with mental math because of issues with their working memory. And of course, it can affect your grades or professional performance. And cognitive flexibility is important to be able to break patterns. So it's also important to switch tasks. And that's why a lot of times people with ADHD, they will, if they're really focused on something, you could yell and scream in their face and they will not pay attention to you because they're so hyper-focused. It's because of problems with cognitive flexibility. And sometimes it can prevent you from thinking outside the box or being creative or coming up with interesting problem-solving solutions because you're unable to shift your perspective due to problems with executive functions. And it can also cause interpersonal issues because, again, you cannot look at the situation or the argument or the whatever it is that's affecting your relationship from the other perspective. Your brain is so set in its ways that it's difficult to pull out of it and look at it from a different angle. And all these three executive functions, working memory, inhibitory control, and cognitive flexibility, are very interdependent and linked. So that means in order to have a good inhibition, you need a good working memory. You need to be able to hold on to your goal in mind so you can determine what information is irrelevant and what you need to ignore. And in the same way, inhibitory control is important for working memory because in order to focus on something or remember something, you need to get rid of internal and external distractions. And your inhibitory control helps you to ignore all those external distractions so you can remember whatever it is that you need to for that short period of time. And both these things together are important for cognitive flexibility. You need to be able to ignore your usual routine if you want to try something new, and you need to be able to have the old working plan in mind if you want to change it and come up with a creative solution. And all these things together are important for reasoning, problem solving, and planning. And because ADHD brains have such impairment in the prefrontal cortex and their executive functions, they often have difficulty planning ahead or making rational decisions or thinking of consequences. So they will know that they have a test tomorrow, but in that moment they just want to play a video game because their brain cannot comprehend that when tomorrow comes, it's going to be a problem because unless it's right on top of their head, because that's how their brain works. So it's almost ADHD is like having a Ferrari for an engine, but then having bicycle brakes. So you have all these ideas and energy and all of that, but you just don't have the right inhibition. And so you're going to crash and burn. But with the right tools, if you understand what is going on in your brain, you can actually fix it and come out as a winner. So what are the things that we can do? First of all, to know what happens in an ADHD brain, we want to know how people currently diagnose ADHD. Okay, there are several, still not a lot of good consensus on the best way to assess ADHD issues. One of them is a behavior checklist. So it's the Conners rating scale. It's very common. It's a simple evaluation method, and teachers will answer it, or parents will answer it, or self if you're an adult. The limitations of this is that the symptoms can be quite subjective. It also is difficult for studies when you're comparing what one person thinks is inattentive compared to what the other person thinks. Then there is continuous performance tests. So these tests specifically measure attention span, impulse control, and even your information processing speed. So all these are executive function issues. But again, there's some limitations because people are not sure about the validity of the tests and the standards that are used. And then you have the DSM-5. The advantage of that is that it uses standardized diagnoses and treatments, but it's a wide array of symptoms and checklists. So there's a big risk of misdiagnosis or overdiagnosis. But recently, we have brain imaging technology using QEEG. The advantage of this is that it can help identify specific areas of the brain and even the specific brain waves that are not functioning optimally. The limitation to this is that it is a new-ish technology so far. It needs to be more widespread use so that we have better standards and controls, but which is happening. Do I need to take a look at anything here? Okay, so So we're going to talk about, for the rest of the talk, I'm going to talk about using EEG technology, which is electrophysiology, electroencephalography, to understand the electrical activity of ADHD, and to understand EEG's role in both assessment, understanding of ADHD, and also as a treatment method. So first of all, what are the different electrical activities? What are the different brain waves in your brain? There are four main ones. There's the delta wave, which is the slowest brain wave. So 0 to 4 hertz. That means it makes a wave 0 to 4 times in 1 second. And there's very high delta activity when you are sleeping or drowsy, close to sleeping. Then there's the theta activity, which is 4 to 8 hertz, slightly faster than the delta. And theta is the way I describe it. Sometimes when you're driving down a normal route and you completely zone out and don't remember the last 5 miles, that's because you're in theta state. So it's that zoned out state, daydreaming state, that's the theta state. Alpha state is your frequency band from 8 to 13 hertz, and it's more a relaxed awareness state. So if you're just relaxing on the beach, or you've just finished giving a presentation and now you're sitting down, that's when you're in alpha state. And the beta state is the faster brain waves from 13 to 32 hertz. That's your alert, awake, conscious state. Right now, you and I, we're in beta state. Hopefully we're all in beta state if you're paying attention and not zoning out. And that's your most common, your brain will most probably be in beta state whenever you're doing anything consciously and doing activity, anything. So now that we know that the different brain waves, we can use maybe QEEG to understand the dysregulation in the brains of ADHD people. I'm just wondering if any more people need to. Okay. All right. So here is the QEEG map on the left. The green is a neurotypical brain, and the red is an ADHD brain. So the colors range. So red is 3 standard deviations above normal, and blue is 3 standard deviations below normal, and everything in between. And you can clearly see in the ADHD brain, there is extreme activity in the prefrontal cortex. And then there's a lot of other changes in the middle of the brain and also in the back of the brain. This is the total EEG. So all the brain waves, alpha, delta, theta, beta, everything combined. Now on the right side, you see the split up of the delta waves, theta waves, alpha waves, and beta waves in ADHD. And 2 specific things I want to point out is the theta waves. So look at the theta column in the normal, and then look at it in the ADHD. ADHD has significantly more theta activity in the frontal regions than compared to normal. And similarly with beta, there's a lot more blue in the ADHD brain, especially in the frontal brain. So it's significantly lower in beta activity. ADHD brains have high theta, low beta in the frontal regions. So maybe now we can use brain mapping as a diagnostic purpose, since we see a clear typical presentation of ADHD brain versus a neurotypical brain. Now, the interesting thing about brain mapping is that you can see a lot of information. So you see amplitude, you see frequency, you see relationship between the different areas of the cortex, but it also helps to quantify the amount, distribution, and ratio of the different brain waves. So apart from seeing just theta, just beta, you can see theta versus beta ratio in the different brain waves. And then you can also see the amount. So not every ADHD person will have the same amount of theta activity or the same amount of beta activity. So you can get more specific information about each ADHD brain, and that will help you give more specific solution for that ADHD brain. And the great thing is it is completely non-invasive reading of the brain. So you don't even have to go inside a machine. It's not like an fMRI. You just have sensors that you put on your scalp, and completely non-invasive, no medications. You don't have to ingest anything. And it's already being used as a way for diagnosis of many other neuro conditions like depression, anxiety, migraine, because they have such a typical pattern. Now, what do they see when they did brain mapping for a lot of these ADHD type symptoms? So for distractibility, what we see is abnormalities in the beta and high beta frequencies. So there is reduced beta and high beta in the frontal regions. For hyperactivity and impulsivity, they see that people have a low SMR activity, which is the sensory motor rhythm. And for the combined ADHD symptoms, you see unusually high theta in the front and higher theta than beta activity. So not only is the theta high, but the theta-beta ratio is also unusually high. That means beta is really low, theta is really high, overall putting the theta-beta ratio much higher than the regular theta to beta ratio. And now that we know this, can we use the EEG system that we use for assessment as a way of treatment? So one way to do this is using neurofeedback. What is neurofeedback? So neurofeedback means feedback for the brain. Now an analogy I often use is, imagine you're walking by a mirror and your hair is messed up. Now when you look in the mirror, you get that information about your hair being messed up, so you fix it, right? So that's exactly what you do with the brain in a neurofeedback session. You show the brain its own activity in real time, and when the brain sees what it's doing wrong, it can essentially self-correct and self-regulate. Because the brains have a self-regulating mechanism that only they know what they're doing wrong. So that's what neurofeedback is. It is a mirror for your brain, so your brain can see what it's doing. And this is what basically happens. The software extracts real-time information from the brain using EEG sensors about the brain activity pattern, and then transfers that into an audio-video screen. So you get a continuous audio and visual feedback of your own brain activity. That can then train your brain and strengthen specifically desired brain activities or reduce undesired activities. So it's based on the principle of operant conditioning. Now, how exactly would this work for ADHD? So what you do is you have an individual who's hooked up to the EEG sensors, and the EEG sensors are monitoring and listening to your brain activity. And this information about a brain activity is translated by the software onto video output. Now, every time the brain is doing something desired, which is focused in this case, every time the brain is focused, the screen will be full screen, sound will be clear. But if the brain gets distracted, hyperactive, restless, the screen will start getting smaller, blurrier, and the sound gets more muffled. Now, the big screen and the good sound, they are a positive reward for the brain. Brain likes it, so brain will try to do more and more of the activity that gives it this positive reward. So then it starts going into this loop. It gets more reward, so it does more focus. Gets more reward, focuses more. Gets more reward, focuses more. And it do this repeatedly. And over repeated sessions, now this new way of being more focused or being more calm becomes your brain's natural habit, because your brain has now self-regulated itself because of this reward. So then once you stop doing this neurofeedback, now this is your brain's new pattern, regardless of whether you do more sessions or not. So it has a lot of long-term implications, which is quite different from medications for ADHD. So there's some commonly used protocols for ADHD treatment. One of them is the theta-beta training. So theta, the frequency, as I mentioned earlier, is 4 to 8 hertz, and the beta is 13 to 20. Theta is the zone out, and we know that ADHD people have higher theta activity in the frontal cortex. We saw it in the brain maps. And then beta is your alert, awake, conscious state, and we know that ADHD people have reduced beta activity. And then there's SMR training. So SMR brainwaves are the 12 to 15 hertz brainwaves in the sensory motor cortex, and ADHD people have low SMR activity. Low SMR means less inhibition of motor activities. So if you have less inhibition, you're going to be more restless. And then there's SCP regulation. These are really, really slow brainwaves, less than 1 hertz, almost close to 0. And people with ADHD have basically dysregulation of this SCP. So it's not necessarily high or low like in theta, beta, and SMR, but there's a dysregulation, there's a dysfunctional regulation. So how do we treat, now that we know this information about ADHD brains, how do we actually treat it? So for theta, beta training, we do it in the central and frontal regions. ADHD people have higher theta and less beta. So the training goal is to decrease the theta band and increase the beta band. So this will be the reward threshold we set. So when the person is doing the neurofeedback session, we set a certain threshold for theta. If the brain crosses this threshold, you don't get a positive reward. You have to keep your theta activity below a certain level in order to get the positive reward. And at the same time, you have to keep your beta above a certain threshold in order to get the positive feedback. So you will only get that positive feedback if you're doing both, keeping your theta low and keeping your beta high. And the result, expected result, is for you to be more alert and focused and not zoning out while still being relaxed and not hyper. And then we have the SMR. So this is on the sensory motor strip in the central right hemispheric region. And as I mentioned, ADHD people have reduced SMR activity, which means they have reduced inhibition, so they're more restless and more active. And the training goal here is to increase SMR activity. Increase SMR, so increased inhibition, so there is reduction in hyperactivity and impulsivity symptoms. And here is the fairly recent study from 2015 where they used, so they did the study with 16 participants, and they do it in 2 phases. The first phase is 15 sessions of SMR neurofeedback training and reduction of theta. The second phase is another 15 sessions of increased beta and reduced theta. And then they look at 3 different things: the inattention, hyperactivity and impulsivity scores, and the combined scores. So sorry about the tiny figures, but basically this is where they start. After the first phase, you already see significant reduction. And then after the second phase, you see a further reduction for attention. Similar pattern for hyperactivity and impulsivity. And here is the combined. So when they start where they are, after 15 sessions of SMR plus theta where they are, and then after 15 sessions of beta and theta where they are. So there's significant improvement of inattention during the theta beta training phase and significant improvement in hyperactivity impulsivity after overall training. Then the other thing we talked about is the SCPs. So these are slow cortical potentials, and they're based on electrical activity in the brain, usually less than 1 Hertz. It's almost close to 0, actually. They're really, really slow waves. And they oscillate between surface negative SCPs and surface positive SCPs. They have to be generated. They're event-related SCPs. And in the SCP negative, it reflects increased excitation and increased attention and initiation of goal-directed behavior. So you have a goal and you plan all the things around it so that you can fulfill that goal. Whereas positive SCP indicates reduction of cortical excitation, and it shifts into positive when the resources are consumed to perform the task. Now, what happens in ADHD people is they don't make enough of the negative shift. So they have little or no energy to process the stimuli and be able to cope with the task. So they have reduced negative SCPs and basically a general dysfunctional regulation. SCP corticals are not regulated properly in ADHD people. So the training goal for them is to increase regulation of cortical excitability. And the result is increased attention and initiation of goal-directed behavior. And they do this in the sensory motor cortex. Now, there is a very recent meta-analysis from 2020, I think, yes. And they look at a lot of different meta-analysis, randomized controlled trials that are using the standard neurofeedback protocols that I mentioned. So SMR training, theta-beta ratio training, and SCP training. And they look at it, and the y-axis is the efficacy, so effect size. From 0 to 0.4 to 0.6 is considered medium efficacy, and 0.6 and above is considered high efficacy. And the first graph over here, so the light gray is pre to post. So how much efficiency they saw after they finished their number of sessions. And the black bars are follow-up sessions after 6 to 12 months without any further neurofeedback sessions. So the first set over here is slow cortical potential training. So you already see a very high efficacy at the end of the training, and then it sustains, the results sustain after 6 to 12 months, even with no additional sessions. So you see the same thing with the combination of SCP and TBR. For TBR here, you see medium efficiency at first, but at the follow-up session, you actually see increased efficacy. That means the results don't go away. In fact, some of the results even strengthen even after you stop doing more neurofeedback sessions, because your brain is now used to it, and every time it's going to have this new pattern. And finally, over here is the SMR. Again, you see similar, even after no follow-up sessions, there's no reduction in the effects, and it's also medium efficacy. So you see significant efficacy of standard protocols, and these effects are sustained at 6 to 12 months follow-up with no further sessions. So, so this made sense to see if this is true, the efficacy, how long it lasts. And so there's a couple other studies people have done, and This one was done with 93 people with ADHD and 23 control groups. And I want you to focus on just the dark black graph. And this is inattention score, impulsivity score, and hyperactivity score. And in the inattention, you can see that the dark, which is the neurofeedback group with the theta beta, you can see post follow-up. So this is also 6 months after no additional sessions. There is no reduction in efficacy. The inattention score does not go up. It stays low. Same with impulsivity score. It doesn't go up after. It doesn't go up significantly after no follow-up sessions after 6 months. And same with the hyperactivity score. You see a decrease at the end of the training session, and you continue to see the decrease at follow-up sessions after 6 to 12 months. This is just 6 months, sorry. Okay. So what are people doing currently to treat ADHD? The first line of treatment is immediately pharmacology, with some additional counseling and maybe some parent training or teacher training. But mostly it's stimulants like methylphenidate or amphetamines, or non-stimulants like amoxicillin. But the mechanisms of both of these are they're working on neurotransmitters. So for stimulants, it increases the dopamine and norepinephrine, because it has been known that people with ADHD have reduced dopamine as well as reduced dopamine transmitters. And both dopamine is your reward molecule. So it is the molecule that seeks and searches for reward and then motivates you to go take that action to do that reward. And people with ADHD don't have enough dopamine. That's why it's very hard for them to focus on something that they're not interested in. The brain just doesn't make the basal level of dopamine that keeps them interested in a task that they're not interested in. But if they're playing video games or doing something they really enjoy, it's fine, because that's their threshold. And norepinephrine is the molecule that's required to stay focused and pay attention without getting distracted by other things. And these stimulants increase both of these neurotransmitters. And the non-stimulant inhibits the reuptake of norepinephrine. So once norepinephrine is released in the synaptic cleft, it doesn't take it back. So it stays there for longer, so ADHD people can focus for longer. The issues with pharmacological solutions for ADHD is that it's not really a solution. It's more like a Band-Aid. So it's not going to fix the problem, but it is going to just help you manage the symptoms. So it's like wearing glasses. If you don't have a good eyesight, you wear glasses, you can see things properly. But as soon as you take off your glasses, of course, you cannot see it anymore, because the glasses are not fixing your eyesight. They are only fixing your ability to read in that moment while you have the glasses on. And that's the same thing that these medications do. So as soon as you're off these medications, after a while, the neurotransmitters re-regulate to your original basal levels, and then you're back to having low dopamine or low norepinephrine. And apart from that, they have a lot of other negative side effects, like people have trouble sleeping, reduced appetite, growth suppression, abdominal discomfort, dizziness, irritability, especially for adolescents. And it also has a risk of increased heart rate. So how about but they are known that while you take them, you see a really good result in your attention. So does neurofeedback compare to the positive effects of the medication? So they did a study in 2013 where they look at methylphenidate and compared it to neurofeedback training. So this is the score. This is pre-treatment. This is at the end of treatment. This is the 2-month follow-up. And then there's a 6-month follow-up, and you see it is significantly. It is quite similar. There is no downside to doing neurofeedback compared to pharmacological treatments. So you can avoid the negative side effects while you still see the continuous significant improvement that you see with medications, and it is completely non-invasive. And then they also did a study in 2015 looking at other cognitive training. So there's also other solutions out there like attention training and other cognitive training. So that's what they did here. So they're looking at control, cognitive training, and neurofeedback training for ADHD. This is pre-intervention, and then this is at the end of their training program, and this is a 6-month follow-up with no additional training. So you can see that compared to the control and cognitive, the neurofeedback group goes down at the end of training and continues to stay down with a 6-month follow-up. And same, that's for inattention. And then for hyperactivity, impulsivity also, they start high at pre-intervention because they're ADHD kids, and then you decrease at the end of your training program, and that effect stays consistent until 6 months follow-up with no additional sessions. And so it gives you all the benefits, plus it is safe, it is non-invasive, there is no medications involved. It treats the issue at its core. So it's not just putting a Band-Aid on. It's not just giving you a temporary solution. It's a long-term solution. And it uses your brain's own natural ability to regulate itself. So then this becomes your new brain. You don't constantly need to support your brain and supplement it with other devices or other medications. And while neurofeedback is a really great and effective way to help treat ADHD that is not pharmacological, or if medication doesn't suit you, but there's also other things. If you understand what is going on in your brain, if you have ADHD, if you understand your issues with executive function, if you understand your issues with working memory, inhibition control, and cognitive flexibility, then you can make micro hacks and some lifestyle changes in your life to deal with this and support your brain in as many ways as you can. So for inhibitory control, what can you do? The easiest thing to do is remove temptation. So if you are trying to lose weight and you're an impulse eater, just don't keep temptations around you. Rid your house of all kinds of fatty foods. And it's a way that almost everyone uses. I mean, if you just increase fiction to the thing that you don't want to do, you're less likely to do it. And if you know that your brain is lacking in inhibitory control, you need to give it this extra support by removing the temptation or adding some distance between you and the temptation. Building self-discipline in a small way. So don't aim for, I am going to finish my dissertation tomorrow. Be like, okay, I'm going to do this much and set clear goals, because it's easier for an ADHD brain. Otherwise, it gets caught up in the overwhelmingness of large scale and grand ideas. What can you do for inattention? So have a dedicated space, whether it's your workspace or school space. You know your brain has a tendency to get distracted easily. So help your brain out and create a space where there is no distraction. Use timers. So you need to use an actual timer. Don't use your phone, because again, that's a distraction. So use a timer and set it up that you have 30 minutes to finish this job and you have to finish it. Or even timer for your break. So you have a 5-minute break, and as soon as the timer rings, you're back to work. And eliminate distractions on your phone. So one thing that really changed my life was cleaning out my home screen on my phone. So all those time-seeking apps on your home screen, just take them off. Make it a little harder to get to them, and put them inside folders. So put everything, Facebook, Instagram, TikTok, whatever, put it inside a folder and move it away from your home screen. It's a small thing that makes a big difference long-term in your attention and time management skills. What do you do for hyperactivity? Add physical exercise. If you burn off that excess energy, you're more likely to stay focused when you're doing the actual task you need to do. And exercise has the additional benefit of increased norepinephrine, increased dopamine, increased serotonin, which are all things that are missing or at low levels in people with ADHD. So it'll help you stay more motivated and help you stay more focused, and also improve your mood regulation, which also people with ADHD have trouble regulating. Use things like fidget spinners. They are actually made for people with ADHD so that they don't constantly, they can do it on the side and let off this excess energy and then focus on what they need to do. And don't forget to take rest. Because ADHD people have, sometimes when they're in hyper-focus mode, they go full speed and then they crash. So remember to spread your activities out, spread your day out. And what can you do for working memory? So this is a big one. I mean, this is why it's hard for people with ADHD to follow multi-step actions. They will almost always forget something. So break your information down. Don't try to multitask. It sounds tempting to somebody with ADHD because they always want to do this and that, but it's actually counterproductive. And make a checklist. Put everything down, because you are going to forget, because that's how the brain works. So help your brain out and figure out a strategy that works for you. Always make a checklist. And for cognitive flexibility, if you have trouble looking at things from a different perspective, creative solutions for a problem, actively seek out new experiences. Don't get caught up in your daily life. Try to do something new, even if it's scary, even if it's hard. Meet new people. meet new people in today's day and age, and practice creative thinking. So you can do simple things like pick up, I don't know, like a glass, and think of 10 things you can do with this glass. Well, that is not drinking from it. So, you can use it to make a circle. You can use it as a phone speaker, whatever. So just pick up any object and just keep activating your creative side. And that's all that I have for today. And if you have any more questions, if we cannot answer them right now, you can follow me, follow our business account, Evolver in Training, on Instagram, Facebook, LinkedIn. Okay. Let me make current host. Let's see. Okay, Taran, you are unmuted.
Yes. That was a brilliant presentation, and this presentation really reminded me of Richard Feynman. So when I was reading about him, so he says that a person who knows what they do is can explain any complex idea to a 7-year-old. And I think this was something I can relate that to, let it be from neurofeedback or to sensory cortical potentials, and the impact that you had was amazing, and we thank you for that.
Thank you.
And we have a few questions.
Okay.
So yes, so the first question is, what are the primary causes of ADHD, and if it can develop later on in life, whether the onset can be later apart from the typical onset?
Okay, so most ADHD is genetic. Most parents, if you have ADHD, your children are very likely to have ADHD. And if you have one child with ADHD, they're very likely to have a sibling with ADHD as well. So a lot of it is genetic. And of course, it's exacerbated by the kind of lifestyles we live, the always on culture, always being around this phone and the dopamine it provides and stuff. But it can develop later in life, not develop as such, but people may realize it later in life. Because if you have lived, because there's different levels of ADHD. For some people, you don't even know, you can't even tell that they have ADHD because they're able to manage their lifestyle well. For some people, if you take them out of their normal, so they may not have any issues in school because the parents are taking care of them and, making the schedule for them, taking them from one place. So they don't actually have to make the planning and the activities. But then when they go to college or when they go get their first job, then there's all these new elements and they have never had to do it before. And they may not be good at planning and never even know it, because they never had to do it before. So sometimes people can realize some of the symptoms later just because they never had to deal with it before, or their life was different and now there's a completely new element and they're not prepared for it.
And next we have, how can we characterize ADHD on a neuronal level? Is it due to delayed maturation of neurons or an abnormal cell-to-cell interaction?
So multiple things, they have different neurochemistry, they have different neurophysiology. The volume is even low. So there's less neurons even for some people. There's less dopamine, there's less dopamine transmitters. There's a change in brain waves. So they may not actually be any neuronal difference, but just the fact that the way they communicate with each other is different, because again, the neurotransmitters are different. So, and there's people don't really know exactly what is going on. There's a lot of things that are associated with ADHD.
And there's still ongoing research, I believe.
Yes, absolutely.
So another question is, can ADHD be a causal factor of any other personality disorders, for example, like antisocial personality disorder?
Yeah, it's hard to say. So there are many comorbidities, like I mentioned. People with ADHD are more likely than the general population to experience anxiety or depression. And that can come sometimes from ADHD problems. So if, for example, your mood dysregulation is so bad, for some people with ADHD, mood dysregulation is a real issue compared than other things. So if mood dysregulation is preventing you from having good relationships with people, it can cause then like a side effect of anxiety or feeling closed in or antisocial disorder or other things. So there are ways it can be the cause in that sense, but not directly that it is causing you, this other issue neurochemically or neurobiologically.
So we could not establish a direct relationship.
Correct. Yeah.
So how many neurofeedback sessions would be needed for a typical patient if they have a set goal? For example, say they have a dissertation or they have their master's thesis on the line. So is there a timeline which we can look forward to?
So you can have the set goal of dissertation, but these are going to be long-term effects. So it's not, you don't just do this to finish your dissertation on time. You do it because you want a lifestyle change and you want a new brain at the end of it. The number of sessions vary based on your initial conditions, how often you can do them, all those things. But generally, people do between 25 to 40, and that seems to be sustained effects for most people, unless you have some severe conditions or you just start off really high.
And what is the time duration of each session, if I may ask?
Anywhere between 30 minutes to 45 minutes.
And considering this to be neurofeedback, I think the paradigms are tailor-made for every patient.
Correct. That's been one of the issues with good research, because there's everything else, they want the set protocol. They want like a standard. So if you're studying pharmacology, you give everybody these many milligrams, and that's standard throughout. But for neurofeedback, it's hard to do that because I can't have a set protocol for everybody. So that's why there's been a lot of problem getting really good research and really good control studies and standardized studies, because there is no such thing as a standardized protocol for neurofeedback. It's going to be different. The frequency I would train you at would be different than the frequency I would train myself at. So it is very personalized and specific.
Next question we have from Kirtana is, can the patient get sensitized or habituated to the drug? I mean, can they get used to it over time? Can they develop a threshold over time?
That's the idea. I mean, the idea is that this becomes natural and then you don't need it anymore.
Yes.
Yes.
So, which means, unlike, for example, when we talk about anti-epileptics, we wean them off in a very staggered manner where we drop the dosage very minimally. So, how is weaning off drugs in ADHD?
Oh, drugs. Sorry, I thought you were asking about neurofeedback.
No, I'm talking about drugs. Yes.
Okay. Yeah. No, for sure. Drugs. Yes, some people develop tolerance, and then you need more, and then you wean off, but. It's a long term, like most people take drugs for like years, at least, they take it all the way through school or all the way through college or whenever they feel like they need to. And then they just manage. They still never get cured from ADHD. They have just developed coping mechanisms and management tools to manage their ADHD. Because once you take the drug away, I mean, after 6 months, there's no effect on your brain. Your brain goes back to its basal levels, and it's just because while they give you drugs, they also do counseling, and they also tell you what all things you can do to change your life and to be more manageable. And then once you get off the drug, this is what you do to manage your ADHD. But you will never feel exactly the way you did when you were on drugs.
Yeah. So we have one question about when do the symptoms of ADHD become conspicuous? And when is it explicit?
There's no, so I mean, it can be from 4 to 5 years. For some people, it can be, they won't even know until they're a teenager. For some people, they won't know until they're an adult. So it's hard to say. But by 5 years, you can still see, you can go through the checklist of DSM-5. You can do you can do the continuous performance test. You can do EEG anytime. You can do any age to see if you see the ADHD representation in the brain or not.
So when we're talking about EEG here as a diagnostic tool or as a marker, as an indicator for ADHD, what kind of sensitivity, specificity are we talking about? Do we have any research supporting, evidence for this, as in like?
Yes, that's how they came up with the SMR training and theta beta training, because they found, they from multiple studies, they were finding a similar typical EEG of a person with ADHD. They would always find increased theta activity in the frontal. They would always find decreased beta. They would always find low SMR. So that's how they developed these. Sorry about that.
That's okay.
Yeah.
So this quantification of these ratios, these SMR or the TBR, so although these are tailor-made for every patient, how do we quantify as to this person needs this many sessions or this person needs this many sessions?
So generally, I mean, almost always start with the 20 or 25 sessions for everybody. And then a lot of it is based on, after each session, we do a feedback. So a lot of it is based on feedback of the client. And then on top of that, we do brain maps at intervals. So after 10 sessions, we will do a brain map again. We will also do their own symptom tracking again. And we will do the continuous performance test. So it gives us a marker that, oh, we have improved so much. Then after 20 sessions, we will do that again. We will repeat the brain map, we will repeat the test, and we will repeat the symptom tracking. So we always use 3 measures to see if you're going in the right direction or not. And whenever you feel that you have what it takes, you don't need any more sessions, you stop then. Most of the times what people do, so there is no such thing as overtraining with EEG. So a lot of people, I mean, I have myself done like 100 sessions, and I will continue to do because I have the machines myself. But there's no such, because there's no limit on how much you can improve. So you can keep improving. You can keep, you can keep improving your theta to beta ratio. You can keep doing all of that stuff. So there's no like fixed number of sessions. It doesn't mean that after 40 sessions, you cannot have any more benefit. That's not true. If you do 50, you will have more benefit, but it's not necessary. And then you don't need to do them so regularly. So usually we recommend twice a week, at least for the first 20 sessions. And then after that, depending on how you feel, we can wean it down to once a week or once a month, or only whenever you feel like you need it.
So are there any studies, this would probably be the last question, are there any studies which show where the patients were on and off medication doing the neurofeedback?
Yes.
And
yeah.
And what difference, like for example, when we talk about myasthenia in that case, when we take them off pyridostigmine, they see a lot of variation, and this is used as for a prognostic purpose as well. So can this be related to ADHD in a similar fashion?
Sorry, say that again.
For example, testing for myasthenia is for example, when we talk, they have tests called repetitive nerve conduction and stuff. So they take them off medication to see how the actual performance is. For example, the function of the peripheral nervous system is. So when ADHD patients are on medication, do we test them off medication or when they are?
Both. So there are some studies where they tell them not to change anything about their medication. They tell them to keep the same medication levels, and then they do these studies and then see the effect of medication plus neurofeedback, and the people that are only doing medication with a control neurofeedback, which is a sham neurofeedback. So and then there's other set of studies where they do a complete flush out. So they ask people who are on medication to stay completely off medications for 3 months before they do any neurofeedback training for them. So there are multiple studies where they've done different combinations.
And I think this is the last one question which came in, and that is if the medications to ADHD have any addictive effects, because as we are talking about dopamine levels and the reward pathway, does it have an effect?
It's an amphetamine. It's basically like it's the same formula as cocaine. So yes, it is addictive. But of course, you do it in smaller levels. And if you are following your doctor's orders and doing it the way you should do it, most people do not get addicted. But it is an addictive substance. It's an amphetamine.
Yes. So I hope the participants got the best of all the questions. So, I mean, this was pretty much, we expected it to be interactive. And I guess it is, and I think most of them have shared their questions. And for the participants, if you have any further questions, I think you can contact Dr. Gala on her handles directly. And yes, so that was Dr. Gala, the founder of Evolve Brain Training for you all. Yes. So, and tomorrow's first morning session is by Dr. Shamita Bose on handwriting. And yes, we encourage the participants to take part in the competitions and check the website for more information. And Dr. Gala, it was an honor having you on the Brain Awareness Week to talk. And this has been a great experience, not just on the talk, I mean, especially while problem solving earlier as well. And we thank you for this. And yes, I don't think I'm going to forget this either. So this has been a great time. That was a great time meeting you as well.
Right.
Thank you so much.
Just on my website, I think they're asking, so I'll do that. on Insta. All right, bye everybody. Thank you so much. You were a great audience. I love the questions. Bye.
Thank you so much. Thank you.